a woman was concerned about Medicaid, and he said he said two things. He said nobody will lose their Medicaid under the bill, which I don't think is correct. Sure it's not correct. And if he was just talking about the fact that there's going to be some period of years before the Medicaid completely goes away, that's not satisfactory anyway. And he also said there'd be absolutely no effect on Medicare, and that's not true.
Okay, so I have, I'm here wearing several hats. One of them. But I'm not into hats indoors though. So one hat is as a father of a 20-year-old who at 17 was diagnosed with a chronic condition. I think that he would be one of the people who would be subject to being told he has a pre-existing condition. He has medication that costs thousands of dollars a month. And certainly for no fault of his own of having this ailment. So that's one concern. As a father, I'm also a strong supporter of Planned Parenthood. I'm on the board of Planned Parenthood. I think that aspect of the bill is discriminatory. It's going to hit more population hard, the people we serve, the people in this community, where we have in this community and across the country significant support. That this bill is going against him. And quite frankly, as someone who professionally I deal with finance, the irresponsibility of going forward with a bill before it's been scored by the CBO, I think is entirely inappropriate. It is just flying in the face of the data. At least if people are going to vote for something, they should know what it's going to cost the country, and that means us.
And on top of that, there's this whole talk about rushing it through, and that they've had, a couple of days to read it, and they say, oh, it's a short bill because it's only 200 pages, but there still needs to be time to think about it and talk to people and have hearings, which they did for the ACA for 12 months or 16 months or something. And I realize, you just work for him. But do you, I don't see you writing this down, how do you convey to him what we're all here saying?
I can certainly pass that along, and actually, behind there, I'm usually pretty good with names, but there's a lot of folks here.
Sure. Right.
If you guys want to leave.
I'm just curious, does Congressman Reed, is this politics for him, or does he personally, when he opens a Planned Parenthood brochure or go to the website, does he look at that and say, this is bad for the community? I actually feel like this is bad for the community and it doesn't deserve federal funding. Can he really? I'm just curious.
As I had said, the expression that I've heard from Congressman Reed is the concern about the fungibility of the federal money that's provided to Planned Parenthood.
And what does that mean?
The concern that money may be going to the facility, paying a doctor's salary. What is the line? Is my understanding.
So it's like everything gets tainted.
Yes, or in
It's a tainted.
simple terms.
It's a tainted institution to him because it does abortions.
But how does that work? Because there are, these services across the country. In some cases, they're available in hospitals, and I don't see a suggestion to, defund XYZ hospital that may offer that service from time to time in cases of medical necessity or otherwise, because that's there. That whole fungibility argument, which applies in the face of cost accounting, that whole fungibility argument.
I'm still looking up that word, by the way.
There you go. All money is green, and it can all be used here or there, but that is different than allocations of costs. And so I think it's just not consistent. And I have to say, it's great to be able to say, well, I think it could be used there. There are a lot of people who've been looking at this for a long time, and I haven't read Inspector General reports or otherwise where the people who are responsible for making sure the Hyde Amendment was enforced saying, you did this with our money. So given that that's been...
Pass that along. Obviously, I understand the concern from Planned Parenthood. talked to many times.
We got a long-term
about
relationship.
this.
I should have brought you cookies today, but I was cranky.
Oh, that's okay. Got my sandwich there, but, I do pass these concerns along to Tom. I want to make sure that I'm, engaging with you guys.
Yeah.
I can take notes if you'd like.
No, I just, I mean, it's sort of a.
I understand, there's a lot of concern for, Planned Parenthood funding, obviously, and some concerns about, coverages for pre-existing conditions under those, under those.
Right, and something I was reading said that having a C-section is now considered a pre-existing
Oh, it is, yeah.
condition, which, and so does that mean a
And that-
woman who
and
has
that-
a C-section, then she
And
has
that-
another
that
child and
language
she
is
won't be?
specifically noted in the legislation, and I'm not, and I do want to clarify, I'm a caseworker in the office, so I'm not a
Sure.
It's the
legislative
insurance company.
staff, but I do.
It was
but I
just, what it means is
understand
these
that.
were things were pre-existing conditions before the ACA made them no longer being a woman is a pre-existing condition.
Right, and I do, and,
Yeah,
and, I'm sure the MacArthur Amendment has become kind of a four-letter word among some circles, but, there is a provision in there that specifically designates gender as a criteria that you
They
cannot
had a chart
discriminate
this
against.
morning on a Republican talk show that showed the $8 million on the pie chart. It was this much. It's nothing. It's nothing.
for the
It's
high-risk
nothing.
schools,
It's
yeah.
nothing.
Yeah.
It's nothing.
$8 million.
$8 billion,
It's
this is put in the
nothing. It's
amendment
nothing.
yesterday.
It's nothing.
That's what's supposed to be, make it okay for states that want to opt out of.
It's not
I
even
mean,
close.
who want to waive their right to have
It's not even close.
cover pre-existing.
I would take another, the last number I saw was that the fund was allocated at $100 million.
No, it's
No,
an
it's
extra
the
8 billion.
Extra $8 billion.
So that's after taking away like 800 billion, so like.
Yeah.
So could I just ask, as the president of the board of Planned Parenthood, I don't understand, I do understand that Congressman Reed is against abortion. I don't understand why he doesn't support Planned Parenthood, which our affiliate distributed over almost 10,000 contraceptive devices last year. That prevents abortion. Why? So I don't understand how.
So, the concern that I have heard Tom express is the fungibility of the federal money that was applied to Planned Parenthood.
So a couple of points there. I mean,
And please.
Can I just say I'm a cost accountant?
Okay.
And I work with federal funding elsewhere, not at Planned Parenthood. But the rules are just set up that just doesn't happen. We can't by law use our funds to promote abortion, and we don't. That was part of the deal, and we accept that. And so why would we punish more than 10,000 women for doing things that are legal?
Besides which, all of the money we get from the federal funding is used before we do anything about abortion. So it's
And-
not fungible, I mean, it's used up already.
And one more thing, Congressman Reed is not against abortion per se. I happen to be for it. He has exemptions in terms of the health of the mother, rape, and incest. So where are all these young women who do get raped in the southern tier, who do unfortunately are subjected to incestual, and their health, where are they gonna get their abortions? If Planned Parenthood shuts down, these aren't rich women, they can't go to Montreal. But,
And
so
by the
even
way-
in his abortion world,
And by the way, I mean, the Hyde Amendment also allows those same exceptions, which I'm sure you're aware of.
But if there's
As
no
far
clinics-
as the policy
Yeah,
is
if
how
there's nowhere to
that's
go.
allocated, I am not personally aware.
Yeah, I mean, I think the bottom line for me, my role at Planned Parenthood is in public affairs and fundraising, and, Planned Parenthood relies on individual and foundation support to make ends meet, so it's not like even the federal dollars we receive can cover everything that we do. And, the argument, and I've heard Congressman Reed mention the light bulbs, do we change the light bulbs out between appointments, which is
so insulting.
I think there are lots of organizations beyond Planned Parenthood that provide abortion care, and I feel like Planned Parenthood has been targeted unfairly in this And I think only 20% of abortions are performed at Planned Parenthood. So to really put a target on Planned Parenthood's back is not okay.
It feels like it's a target on women.
Yeah.
Getting low-income women or women without insurance or resources.
And I understand, I don't want to sort of beat, beat over the reallocation of those funds to federally qualified health centers to you folks here. So I certainly understand your position on that already.
Well, I would also say that Planned Parenthood employs people, and jobs are important to, supposedly, to Trump and others. And I can't imagine why they're targeting one corporation that's legal.
Can I ask you one thing? Sure. Tell me one good thing about this bill. Tell me why I should not be mad at Congressman Reed.
Why you should not be mad about it?
Mad about it, yeah.
That he's supporting it.
That he's supporting it.
Why
A
is
bill
it
that
good?
hurts so many
Good
people in
question.
his district. That's quite frankly what I don't get. I mean, I have philosophical differences with the congressman on some things. Other things I really support, like his No Excuses campaign. But I do not understand, and I'm not the smartest person in the room by any stance of the imagination, but it's so bad for so many people in the district.
And how
How does he, what's in it for us? When we go to a town meeting, what's he gonna tell us?
Well, there's a provision in the bill that will alleviate the property tax burdens that we see here in New York State that are in this
Please.
situation.
Please,
I know we've had that discussion
Please.
before.
please. The money's gonna come from somewhere, it's gonna come from a different thing.
But I guess at what risk does it put people your
Okay, I'm just talking about the fact, and then I do have to leave it on. We all know that behind this, the elephant in the room is the $1 trillion tax cut that the ACA repealed. And it's tied with some support for Medicaid, but it's basically support Medicare to keep it solvent until 2029. I don't know if you're aware of this. This bill is a disaster for senior citizens. And because of our, just our health, this bill is particularly going to hurt older women who will be on Medicare, who will lose their free mammograms, their colonoscopies. And there are, I think, 116,000 people like that in the district. So when Congressman Reed's men and women who are on Medicare, when he says, I represent everybody in the district, I think, and I'm not a genie, the vast majority of people in this district, many of them voted for Congressman Reed, many of them voted for Trump, are being hurt by this bill and are letting him know it. And so you talk about the property tax, it's the county tax, it's not that much because we still have our school taxes. It's like a teeny fig leaf. So go figure, it's gonna cost me much more for my co-pays and other stuff and what I'm gonna have to pay for than the $200 a year I might save on my county property tax. So quite frankly, that doesn't wash, you know that.
Which will just come back to us through the state
Yeah,
income tax.
yes, it's,
Because they're
I'm
bills
sorry,
that need to be paid.
it's cow poop.
Does anyone have a personal story they'd like to share about how Planned Parenthood has affected you or helped you?
I would say very simply that my son, who's 16 years old, goes to Planned Parenthood, and I don't know about it.
Yeah.
And I'm a happy parent to have a child who feels so empowered that he's just going to go right to his healthcare provider. It's like me not needing a doctor to get a colonoscopy. I don't want those gateways.
Same thing. My stepdaughter, when she was 16, she started having sex, and we said, okay, fine, we can't control that, but you cannot get pregnant. She took herself to Planned Parenthood, and they helped her. And she's almost 20 now, and she's doing great. And I didn't have to walk her through that. She felt empowered. She could go there and be with women who would guide her. I felt very happy for her and for us. So I didn't have to worry about that.
I've been using Planned Parenthood since being a student at Cornell, since 70s. And I know my sons did too.
Yeah, I've been a
very grateful patient at Planned Parenthood since about 1997. And I've received, in Ithaca, and I've received really expert and caring care that I find totally invaluable through even just for the yearly checkups. And then when issues have arisen, they've been met with real compassion and real professionalism, and I am so grateful. So it's meant a lot to me over the years. Yeah.
I've had many interactions over the years, and the first one would be a long time ago in my late teens, when my girlfriend and I, being responsible young adults, decided that what we were going to do in private. We also decided that having a child would irrevocably alter our lives, and together we went to Planned Parenthood. And we received the services. We received the services without judgment. We received the services without involving our parents, and it was something that provided us safety and helped us in our lives, because we went on to college, we went on to lead productive lives without any sort of disruption.